Talupalava, it's Leah Manaya here from Local Doctors. It is World Immunisation Week, and today on How Water Chats, we're here with Dr Richard Hulme to break down how our immune system works to fight infections and how vaccines like the flu and measles vaccine help to support our immune system and to protect us and our families. Richard is a GP at Local Doctors Mangere, Clinical Director of Quality Governance and Education at Tāmaki Health, and Clinical Director at Total Healthcare, PHO. Talafalava, Richard, and welcome to the How Water Chats.
Talafalava, Leah Manaya, and many thanks for having me today.
Richard, I want to have a chat about the flu and measles vaccine, and I look forward to you breaking it down for us in very simple terms. What is the immune system, and how does it work when a virus like the flu enters our body?
So thank you for that question. The immune system is our body's own natural defense against infection. So we have our own natural immunity, which is just like our skin. And if we break our skin, like we graze our knee or something like that, if we fall over, then we lose that protection against infection, and then we can get an infected knee, if you like, infected skin area. So we have our own natural immunity, and then we have acquired immunity where we get protection after having had an infection previously, or if we haven't had that infection, we may have had a vaccine to prevent that infection from happening. So that's acquired immunity. So our immune system is quite complex. You can think of it as some cells in the body. You can think of it as some organs in the body. It can get quite complicated, but I think the simplest way is it's our own body's defense system against infection.
Now, people are different, and we all have different immune systems. Why do some people get sicker than others, and does our body remember viruses?
Yeah, and those are good questions. I think we have to think about who are the vulnerable. So the vulnerable are those that are very young, and obviously those that are much older. And so our immune system, for example, as we get older, our immune system gets weaker. And so the vaccinations are more important because we need extra support to maintain our defense against infection. It's better to prevent the infection as opposed to getting it, right? So the second part of your question, that's our acquired immunity that we talked about before. So once we've had an infection, then we have our immune system develop something called antibodies, and it's a memory. And it's a circulating memory that circulates around our body, so that if we get exposed to certain viruses again, then it helps to protect us against that.
Now, what is a vaccine? We need to be reminded of what the vaccine is and how does it teach the immune system to recognize and fight viruses.
So a vaccine is, you can think of it as like a medicine that our body's given. But in fact, you could say sometimes it's a live virus, but a weakened virus, like the measles, mumps, rubella vaccine, the MMR. That's a live virus, but it's very weak. So it's not enough to cause the infection, but it's enough to make our body realize, ooh, there's something that's not right here. We need to beat up these guys, right? And so you develop a very strong immune response, which lasts a very long time. So that's the MMR, or live attenuated vaccine, or weakened vaccine. And then there's the dead viruses that again, the body recognizes as not part of ourself, and so develops a reaction to that. So that's something like the flu vaccine. The flu vaccine isn't a live virus. So you often hear a story, oh, I got the flu the last time I had the flu vaccine. It's not possible, right? Because it's actually a dead virus, right? So you can't actually get something from it, right? So those are two different types of vaccines that are available.
And using the flu and measles vaccines, Richard, can you explain what's happening in the body and why they're very important?
As I mentioned, when our body is exposed to that vaccine, the the body recognises that this is an abnormal part of us, and it develops the immune response or the antibodies, right? And the antibodies stop it from causing any illness. But the antibodies also say, okay, the next time we see you guys, we know what you look like now. And the next time you're going to come, we're going to recognize you, then say, okay, don't bother, because that's how we develop a resistance to infection. So it's important, as I say, particularly for the vulnerable. So think about your loved ones, think about who are the vulnerable in your families, the very young, the very old, and how do we protect them? How do we create a safe household against the many viruses that are out there? You only have to look at preschools, you have to look at churches, and even going to the supermarket, how you can pick up something very easily. And I think COVID reminded us of that, where we all were very virus aware and wore masks and knew about how easy it was to catch things. And measles is a good example of that, when you only need to have one person in the room with measles and you can infect 18 others.
Can you talk to me about the difference between getting sick naturally and getting vaccinated?
Yeah, so getting sick naturally means you may not have you may not have met that virus before, so you get the infection, and then so you become unwell. But the vaccinated person has had some exposure to that virus before, and so they've got the antibodies that are circulating, and so they don't actually get as sick. They can still get sick, but it's usually much milder than the person that's not been vaccinated or protected. So that's the difference. It's someone who's getting naturally sick will get sick. And so they can get all the symptoms that we might expect with fevers and sore throats and runny nose and cough and the like, muscular aches. Whereas the vaccinated person, they may not even notice anything.
I know you've mentioned it before, Richard, but how serious are the flu and measles, and who should be getting vaccinated?
Those infections are very important. So if we start with the flu first, again, we have to ask ourselves, who are the vulnerable? Right, and the vulnerable particularly are those who have respiratory conditions like asthma and lung conditions called COPD and bronchiectasis, and they may be the ones who get frequent chest infections, need antibiotics more than twice in a year. They might need strong steroid medicines twice in a year. They may even end up in hospital occasionally, and they can be young kids, or they can be older adults, or they could be adults who have got underlying health conditions, not just respiratory or lung conditions, but they may have diabetes, they may be overweight, they may have heart problems. So if that sounds like someone in your family, we would encourage you to get vaccinated against the flu, and do that every year, because unlike the MMR vaccine, which lasts a very long time, the flu vaccine only lasts for 1 year, and then the viruses are always changing, so we need to update that and make sure that you have the latest and best protection against the flu or influenza. The other thing you talked about was measles. And measles, we've been very lucky lately with the outbreaks that we've had in New Zealand, because we've worked very hard on trying to get the immunisation rates up, particularly for measles, and we've done a lot of public health campaigns on measles. The only way we've been getting measles in New Zealand is people arriving in New Zealand from countries that may not have had as good an immunisation program as New Zealand, and so they bring it into the country, and then that virus looks for those who haven't been vaccinated, and it seeks them out. Now, if it meets a wall of immunity where all the people who are around that person that's infected are immune, then the virus stops in its tracks and it doesn't spread. And we've been very lucky in New Zealand recently where we've had no spread. Even though the virus has arrived, It hasn't spread throughout our communities because we have that, what we call herd immunity. Enough people in the community have been immunised. But it doesn't mean that everyone's been immunised. So if you think you may be at risk, you haven't had 2 doses of the MMR vaccine, or if you're unsure, see your GP and practice nurse or nurse practitioner and find out, am I protected or not? And if not, then have a booster.
Hawaii Chats are powered by Tāmaki Health, the team behind White Cross, local doctors, Better Online Doctors, and Connect Radiology. When you enroll with any clinic in our network, you unlock access to all our urgent care clinics, including 3 that are open 24 hours and a 24/7 online care with better.co.nz. For more affordable healthcare delivered when and where you need it, enroll now at localdoctors.co.nz or whitecross.co.nz. Tāmaki Health, the people's primary healthcare provider. As a GP at the Mangere, our local doctor's clinic, what is the response from our community to the flu vaccine, and what are some of the challenges that you face as a GP?
I think we've seen a lot of negative publicity about COVID and the approach with vaccinations during COVID. I think we've seen some unfortunate experiences in Samoa, for example, where there were 2 infants that died as a result of being given the wrong medicine when they were making up the vaccine, and those 2 children died, and the word got out and no one immunised their children, and then we had so many deaths in Samoa because the children were unimmunised. And that's a reminder for us all that deaths still occur when you get these illnesses. They can be very severe, and we know who are the vulnerable, all right? The vulnerable are our very young, but also our vulnerable are the older people when they lose their immunity. It's called immunosenescence is the medical term for that. It means our immune system is aging.
What is one key message that you want our viewers and our community to remember from our Hawaii Chats today?
The first thing is make sure that you're enrolled with a practice, right? Because if you are enrolled with a practice, a medical practice, then they are keeping an eye on your immunisation status, right? Is it up to date? Are you behind? Do you need to have some extra vaccines, right? And then the second one is, think of this as how well protected is my family this winter? Who is the most vulnerable in our family? And I think a lot of young people sort of say, I'm young and healthy, no worries. But it's actually, who are those that are at home, right? And it might be our parents or our grandparents that are staying with us, and they may have a weakened immune system. They may have these long-term conditions like asthma or heart problems, and they're more vulnerable if they get sick. And how can we protect them? If we all create this wall of immunity, if we all make sure that we have our vaccines, then we can protect those at home that we love. Yep. And one other thing I'd like to add is about the importance of childhood immunisation. So we want our children to have the best start in life, and one way we can do that is to make sure they're protected. And there are a number of vaccines that are available as part of the immunisation program or schedule. And we've seen as a result of those vaccines a lot less sick children. A lot less, sick children. So, for example, many decades ago, diarrhea in kids was such a bad problem. And we would see children coming in with 20 times a day of pooey nappies and very dehydrated, needing to go to hospital. That has completely gone, right? So, thank goodness for these vaccines. And I would encourage you to make sure that your children are protected. And the MMR, of course, is part of that immunisation schedule. But I would encourage you to give your children the best chance and best start in life by making sure that they're fully up to date with their immunisations.
Flu vaccines are here. You know how winter hits. 1 minute, you're all good. Next minute, you're unwell. Let's not do that this year. Pop into your nearest local doctors and get it sorted. Easy, quick, no booking needed. Free if you are eligible, or just $30 if you're not. Go on, get protected before the bugs start doing their thing. Thank you so much, Richard Hulme, Dr. Richard Hulme, for your time. Is there a final message for our community today?
I think about there's always been a lot of negative criticism about vaccines, but I think we need to change that, and we need to start thinking about how well are we protected. Just remember, COVID is still out there as well, so we need to make sure that we're protected against COVID, particularly our vulnerable, right? So if you think that you may have got COVID, test yourself, and then think about mum and dad or grandparents. They may need to be protected. And if they become sick, there's medicine available for them to keep them out of hospital. That's my message.
Whāwhai tele lava, Dr. Richard Hulme, for joining us and sharing your wisdom with our community and our viewers. Thank you for watching Hauora Chats, brought to you by Tāmaki Health. Stay safe. Tō whāsui fua.